Good morning, everyone. Thank you very much for coming here on a Sunday morning. My name is Dr. Prasad Raj Dandekar. I'm an oncologist based in Mumbai, and I really apologize. I was supposed to be with you today in Kolkata. I'm still recovering from my COVID symptoms, so unfortunately, I could not come. But I cannot tell you how much I was looking forward to this and how much I'm going to miss the whole event. So before we begin, I just wanted to give you a little bit of a background as to why are we doing this conference. Um, a few years ago, I'm an out gay man. I live with my partner in Bombay, and few years ago, I unfortunately faced a terrible homophobic attack from a colleague of mine whom I had known for a long time. And of course, it made me extremely unhappy, and I was miserable for many days. Over a period of time, I realized that the reason why he said what he said was possibly because of ignorance. And then I said, what can I do to remove this ignorance? And through that was born Health Professionals for Queer Indians, which is an initiative which I run, which under which I basically work on sensitizing healthcare professionals to the healthcare needs of the LGBTQ community. And this conference and many more that we have done are part of that. I must thank, before we begin, the entire team of the Endocrine Society of India and Bengal, and especially Professor Sanyal for taking great efforts to make this a success and getting everyone invited here. Thank you very much, Professor Sanyal. This meeting actually came to life when I met Dr. Sanjay at Delhi in one of the transgender conference again. Dr. Sanjay Kalra, and that is how this meeting was formulated. So thank you very much, Dr. Sanjay. I believe he's also not able to come for today's meeting. And this would not have been, of course, possible without support of the Lalit Group of Hotels and Keshav Suri Foundation, who have been very, very generous in sponsoring many conferences that we have organized and have been great hosts. And I'm sure they will do a great job today as well. So thank you very much to all of you for coming and supporting this event. Um, and I get questions about. I'm just, as I speak to you, I'm sharing my screen. I'm going to talk about a little bit of introduction to terminologies before we get into the details of transgender health. And the question that I get mainly asked a lot of time is, why do we need to know about LGBT community? I don't see any LGBT community people in my practice. Now, if you take a rough estimate looking at the literature, anywhere between 6 to 10% of the population identifies with the LGBT community, which means 6 to 10% of patients that you see every day, every week, every month are going to be from LGBT community. If you are not seeing them, that is because they are not feeling comfortable to show you who they are. And that is why we need to work together to ensure that we create a safe space for this community member so that we are able to provide healthcare to everyone equally. So before we begin this conference, I thought I would just share some terminologies to get everyone, especially the maybe the younger residents who have recently joined endocrine course to up to speed. So you must have heard about sympathy, empathy, and compassion. So, as doctors, we are supposed to be very empathetic and very compassionate. But can you be compassionate to everyone all the time? Is it even possible? So, now the compassion that we have is also not unconditional, it is conditional. And our compassion depends on many factors. So, doctors' factors. So, what has been the upbringing of the doctor? What has been the environment at the home? What experiences the doctor has had in his or her lifetime or their lifetime? What sort of training have they had? Which institute are they trained at? What sort of environment was there at the time of their training? There are going to be clinical factors. So, for example, somebody may be HIV positive, and that may change the compassion level because some healthcare professionals may feel uncomfortable about their HIV, or somebody may be transgender, and some healthcare professionals may feel uncomfortable because of that, or somebody may have severe diabetes which is uncontrolled, and you may feel a sense of irritation towards them that, why can't you control your diabetes? So there'll be a lot of clinical factors which will determine our compassion. And of course, there are the patient factors and family factors. How nice the patient is, how nice the family is. How does the patient look? Are they poor or rich? What is their background? Are they similar to me or very dissimilar to me? Are they from a sort of society which I don't like or I do like? So there are going to be a lot of patient and family factors. And then of course going to be environmental and institution factors. So I trained in Tata Hospital, where I used to see 60-70 patients in 3 hours, where I could give maybe 1 or 2 minutes to each patient. In my current practice, I'm able to give like 45 minutes to a patient, right? So, and similarly, what sort of infrastructure your institution has, what sort of culture your institution has, will also have an impact on your compassion. Now, why this is important is that we need to be aware that our compassion is affected by these factors. Only when you are aware, then you can transcend these factors. So you may see a certain person and you may feel a little bit of irritation, annoyance, a little less compassion. But only when you realize that you are feeling that little less compassion can you act on it and change it. Now, there are a lot of terminologies. I'm going to quickly go through them. Sex is basically assigned at birth and is based on the appearance of external genitalia. It's a physiological, biological, and chemical makeup of an individual. But when we talk about gender, it's very, very complex. Gender is the attitude, feelings, and behaviors that a given culture associates with that person's biological sex. So, for example, if I had come to the conference wearing a nice skirt and high heel, long leather boots, it would be a little shocking to everyone. But if I was in Scotland, that's normal there. That's what, a traditional dress for men is. So it's highly dependent on the culture. And gender is not binary. It's a very complex phenomenon, and some people may want to identify with certain gender, and some people may say that they don't identify with any gender. The difference between sex and gender is basically sex is biological while gender is socio-cultural. Sex is from nature while the gender comes from society. And sex is constant, gender can be variable. Now, gender identity is that person's deeply felt inherent sense of being a boy or a man, or a girl or a woman, and it may not correspond to the sex assigned at birth. Okay, so this is where things start getting a little complicated. Then we move on to sexual orientation, which is again very different, which is basically the component of that identity, a component of the identity of that individual, which defines their sexual or emotional attraction to another person. So that person may be attracted to men, women, both, neither, to people who are genderqueer, androgynous, and other gender identities. Now, the important thing to remember is that gender identity, and sexual orientation are not obvious, which means you may have a patient sitting in front of you and you will know none of these things about them. So you cannot presume. The best way to know somebody's sexual orientation or gender orientation is that by asking them. Now, cisgender is an individual whose identity and gender expression aligns with their sex at birth. So I identify myself as a cisgender man, where I was born as a boy and I identify myself as a man. Moving on to heterosexuals, individuals are persons who are emotionally, physically, and sexually attracted to members of the opposite sex. In common parlance, we also call them as straight people. While the homosexuals are people who are emotionally, physically, and or sexually attracted to members of the same sex or gender. Lesbian is primarily a woman who's emotionally, physically, or sexually attracted to women, while a gay individual is basically a person who's emotionally, physically, and or sexually attracted to members of the same sex. Typically, when we say gay, we mean gay men, but it's sort of an umbrella term which can be used for the overall sort of homosexual community as well. Bisexual people cause a lot of confusion in many people's mind, but bisexuality is for real. This is a person who may be emotionally, physically, and or sexually attracted to people of their own gender or another gender. And this attraction is not 50-50. So it again varies with the situation, the persons, the phase in their life, and it's definitely not 50-50. Now coming to today's topic, which is transgenders, transgender individual whose gender identity and gender role does not conform to what is typically assigned to their sex at birth. But as I said, a transgender individual may come to your clinic appearing as cisgender. So suppose if I identified as transgender and if I'm going to a doctor's clinic where I'm not sure how the doctor will react, I may wear clothes like this and sit in front of you, but from inside I may feel that I'm a woman. So it's important that we do not assume the gender of an individual or sexual orientation of the individual who's sitting in front of us. So trans man is a female to male transgender where the person is born as a female or a girl and they identify as a man, while a trans woman is a male to female transsexual where the person is born as male and then identifies as a female. Now, in trans woman, there is a specific sect which is a religious cultural sect called Hijra community. So, not all transgender individuals are Hijras, and so that is a distinction that we have to make. There are asexual people who may not be attracted to any individual and may have complete lack of sexual relationships, and asexual people also exist, and there's nothing wrong with them. There are individuals who are questioning, so they are still unsure about their sexuality and gender identity. Now, coming towards the end of my presentation for today, queer is an umbrella term which sort of includes the entire LGBTQ community. Queer, as you know, as an English word, means something odd or unusual, and it was a derogatory term, but the community has sort of appropriated it, and we say, queer community or queer individuals. I'm going to skip through some of these slides. So there is a derogatory term called a dyke, which means masculine lesbian. This is a derogatory term. Please do not use it on your patients or your any individual whom you know. Faggot is also a derogatory term used primarily for gay men. Now, ally is an important terminology. I expect many individuals in this gathering today are allies of the LGBT community. These individuals are individuals who do not belong to the LGBT community but are respectful and supporting of the LGBT community. And through these programs, we want to build the ally community overall all over the India in the healthcare profession. Important thing to remember. I get many questions, even today. I've been together with my partner for 18 years now. And people ask, so who's the wife in your relationship? And then we have to tell them the whole point is that there is no wife. Okay, you cannot judge a person from the queer community with the same parameters as the heterosexual community. So, if a patient walks into your clinic and it's a young woman and she's come to you with some problem, and if you ask her, what does your husband do? Or what does your boyfriend do? Or where is your husband? Then you are being basically heteronormative. What if that girl does not have a husband but has a wife or has a girlfriend? Or a man walks into your clinic with some complaints related to maybe hormones or some complaints related to sexually transmitted disease, and you ask him, so what does your girlfriend or wife do, or do they also have same symptoms? You are again being heteronormative. What if that person has a male partner, or what if that person has a male and female partner? How do we know? So the best thing is to ask. Homophobia is a negative attitude towards LGBT community, and it's actually a misnomer. Phobia means fear, and homophobia is not about fear. Homophobia is hatred. So homophobia is something that we have to wipe out from our community, and especially healthcare community. Now, coming out is something that we are not really discussing in today's conference, but I want to just make you aware of it. Is a process by which an individual from the LGBT community accepts and comes out to identify one's own sexuality or gender identity, and then that person may share it with other individuals. Now, coming out is a lifelong process. And the most important coming out that any individual from the LGBT community will do is to themselves when they accept themselves as they are. And it's a very complicated process. And as medical professionals, I urge you to support your patients in their process. At the same time, do not pressurize them for coming out. It is important that they come out to individuals that they want to come out to when the time is right and if it is necessary, because coming out can sometimes have serious negative implications, including the person being threatened, thrown out of the house, sometimes even killed. So we need to be very careful about coming out process. I conclude my talk here, the introductory talk, and I hope all of you have a wonderful conference. And I'll join back later in the afternoon with another presentation. Thank you very much, and apologies again for not being able to come today. Thank you.